If everyone would please take their seats, we will get started with today's meeting of the Local Government Committee. Madam Secretary, please call the roll. If you are participating virtually, please notate that you are participating virtually and where from.
Senator Alvarado.
Present in the room.
Senator Harper Angel.
Present remotely in the district.
Thank you. Senator McDaniel. Senator McGarvey. Senator Nemes. Senator Schroeder.
Present remotely.
Thank you. Senator Southworth.
Present remotely.
Thank you. Senator Storm. Senator Thayer.
Here in the room.
Senator Wheeler.
Present in the room.
Representative Bentley.
Present here in the room.
Representative Bray.
Present in the room.
Representative Brown.
Present in the room.
Representative Dixon.
Present in the room.
Representative Donahue. Representative Fleming. Representative Frazier.
Present in the room.
Representative Huff.
Present from the 82nd District.
Thank you. Representative Ems.
Present in the room.
Representative Johnson.
Present in the room.
Representative Koenig. Representative Lockett.
Here in the room.
Representative Marzian. Representative Meeks. Representative Miller.
Here in the room.
Representative Reed. Representative Roberts.
Present in person.
Representative Thomas.
Present in the room.
Senator Mills.
Here in the room.
Representative Meredith.
Present in the room. Madam Secretary, we do have a quorum. This time I will entertain a motion to approve the July 20th minutes from our meeting on that date. Do I hear a motion?
So moved.
Motion, Senator Alvarado, a second. Hear a second? Representative Roberts. All in favor say aye. Aye. Any opposed? Minutes are adopted. This time we'd like to ask Mayor Fisher to come and welcome us to the city of Louisville. I want to thank everybody for being here today, and do want to also recognize our majority floor leader in the House, Representative Stephen Rudy, for being here, and minority floor leader Morgan McGarvey for being here as well.
Thank you, Mr. Chair, and welcome everybody to Louisville. It's fantastic that we're finally able to get back together here after hopefully the worst of this virus last year. I know we're working through the Delta variant right now, and hopefully it will be gone soon, and we'll get back to some sense of normal that we had before all this happened. I just wanted to give you a brief update on what we're going to be doing with our ARP funds here in Louisville. We've been a beneficiary of about $165 million, first off, with the CARES Act. That went to about 25 cities that had populations over 500,000. So our population's over 500,000 because we merged our city and county governments about 20 years ago, so that was a good result of that. We've got about $388 million in ARP funds. We're going to put those to work in the 5 primary areas. The first is to address our affordable housing and homelessness situation here in Louisville. We've got about 300 people that are chronically street homeless that you see primarily downtown. We're kind of a microcosm or an example of what you see in cities all over the country, and we hope to make a really good improvement with both that and the need that we have for affordable housing, particularly at folks at less than 30% AMI. The second area of focus is on workforce development and small business support. We've been able to come up with some methods here to transition people into family supporting wages, whether it be in the technology area or healthcare areas, by use of stipends and guaranteed jobs with some of our business partners here in the community. So we're excited about the opportunity to make some significant work there. and keeping our small businesses alive and thriving. We spent about $30 million, or invested about $30 million in small business grants during the first wave of funding to keep businesses alive and surviving. Little did we know that 2 years ago that would be the strategy, just to survive, to get through this pandemic, but we've been able to do that relatively well as our economy is really coming back nicely here in Louisville. The third area is all about health and getting through the pandemic and some investments in our neighborhoods. And the fourth area is about public safety, both investments in intervention and prevention, but some significant investments in technology with our police department as well to help us with some of the gun violence challenges that we're having here in our city and cities around the country. And then fifth will be a premium pay for some of our frontline workers that were bearing the brunt of the virus, and to recognize the work that they've been doing and did so effectively during that time. So we're excited about the opportunity. $388 million is a lot of money on one hand. On the other hand, we've got $2 billion of deferred maintenance in the city on roads and bridges, and you all know that very well from all of our Commonwealth's needs as well. But we intend to have some system-changing work on that. One last comment, 2020 census data obviously has been released in the past several weeks. The metro area is growing about the same rate as the country is growing. The city of Louisville is growing at a little bit less rate, but I look at it as an entire metro area, so we're doing well from that perspective. I do think, and I know you guys have been working on tax reform. Any way that we can be helpful with that here from Louisville, we certainly want to do that. As we see sometimes when people move, it's for what they see as more beneficial state taxes, state tax policy in other areas. So any way that we can do that and help, we'd like to do that, and always want to make a plug for additional flexibility for local governments to impact revenues if in concordance or in alliance with what their citizens want. So I appreciate your all's work in that area. And one last deal is to update you all on our Civilian Review and Accountability Board that you spent time on in the session this last time. That has been created since we last spoke. They're hiring the Inspector General here in the next couple months as well. So that's well underway and has been helping in terms of both transparency and accountability and building police community trust for us here in Louisville. So I want to thank you all for your help with that. But Mr. Chairman, always good to see you. Thanks for all the good things you do.
Thank you, Mayor. Appreciate the welcome and appreciate you being here with us and the update on the city of Louisville. Also want to say that we do have, not on the agenda, but Ag Commissioner Ryan Quarles here. We want to thank them for the work that they've done putting the State Fair on this week with his shop at the Department of Agriculture, as well as the Kentucky State Fair Board for hosting us. Thank you, Commissioner. We will go ahead and get started with the agenda at this time, and we will, I think, follow the agenda as it is stated. So at this time, if Brian O'Neill and David Hauser would come forward, and anybody else that you all may have that's going to present with you all with regard to firefighter health insurance for retirees. Please just acknowledge yourselves for the record, and then you can proceed with your presentations.
Thank you, sir. Good morning, everyone. My name is Brian O'Neill. I'm the Legislative Director for the Kentucky Professional Firefighters. Thank you very much, Co-Chair Meredith and Co-Chair Mills, for inviting us here today, and to everyone else on this hot August day to talk to this august body. Let my friend introduce himself as well.
I'm David Hauser. I'm with the St. Matthews Fire and Rescue here in Eastern Jefferson County, and I also serve as the chair of the Legislative Committee for the Kentucky Association of Fire Chiefs. Thank you for allowing me to be here.
So what I'm here to talk about today is the impending crisis that we're going to be looking at for retiree health insurance, specifically anyone that has been hired in this state after July 1 of 2003. Though I'll be using mostly firefighters as an example, since that's who we are. This is a problem that's going to affect any employee, whether they be police, fire, EMS, state, county, city, throughout the CERS and KERS system. So in 2003, the state legislature made a change in the retiree health insurance program. Rather than providing a health insurance plan, new employees hired after July 1 of 2003 would get a monthly credit towards purchasing the state health care plan. This is not money that they could use on the open market. Rather, this is a stipend that can only be used at the company store to purchase a plan through the state system. So for hazardous duty employees, is there a tech person, I don't know if I'm doing this right, to pull up this PowerPoint. Oh, there it is. All right, thank you. So it's rather than insurance policy, like I said, they get the small stipend. For hazardous duty employees, that credit is $15 a month, and that is multiplied by the number of years of service. Non-hazardous is $10. And then there's a built-in cost of living adjustment of 1.5% per year. So in 2023, that first affected group of hazardous duty employees, when they are eligible to retire, they're going to get a credit of $21.30 per month, multiplied by 20 years of service, which equals to $426 per month to be used towards a health care plan. So in 2003, legislators believed, and this was an innocuous event, that what they were doing would keep up with the cost of health care, but unfortunately, it just has not. As the stipend has moved forward with that COLA, like the proverbial tortoise, slow and steady and moving forward, the cost of health care has skyrocketed, and it has not kept up at all. If we look at the numbers right now, and that's for 2020-21, the cost of a health insurance plan through the state system is around, for a family plan, it's around $1,500 to $1,600 a month for the middle-of-the-road plan, and for an employee plus spouse, for someone with their spouse, it's about $1,300 per month. So they would have that $426 per month towards that. The family plan, like I said, $1,500, $1,800. They're going to be left with very little of their pension. If you look at, say, an average employer, let's compare just two hypothetical people. They've been given a career. They've given the career to the community. They've given 20 years of their life. One was hired in June of 2003, and one was hired in August of 2003. Both plan to retire in 2023. Both of them were hired into a similar department. They took the same risks, exposed to the same tragedies and hazards, and they carry those same physical and emotional scars with them. They earned a similar salary. They're retiring with a similar pension benefit. We'll say about $3,000 a month. There's some people that'll make more, there's some people that'll make less, but I'm not going to give you a worst case scenario. I'm giving you real numbers. So that $3,000, one person will have their choice of health insurance plans, whether single, married, family, and the monthly premiums will be covered. The other person will get $426 a month towards that health care plan, and again, with a plan that ranges from $1,500 to $1,840 for a family plan. Many of our people, I'm sure most people in this room know, and you have people starting families a little bit later in life, so it is not ridiculous to think that they're still going to have children on that health insurance plan, or even if it's just them and a spouse. So if we pick that middle-of-the-road plan, $1,673 per month, apply the $426 credit, they're going to have to pay $1,247 a month just to have the plan. That's if they never get sick, if they never get injured, and they never have to use the plan at all. They're still going to be out $1,247 a month. That is $14,964 a year just to have that health insurance plan. And you see the numbers there for a married person, $1,075 per month, $12,900 a year that they're going to have to come up with just to have the plan, and that doesn't even consider if they get injured, if they get sick. So now I want you to consider what that's going to mean in somebody in a smaller community. I'm fortunate enough, I work in the city of Louisville. If we look at some of the, there's a little bit better pay in the larger communities. They might get a little bit larger of a retirement. But somebody in a smaller community, their pension's going to be that much smaller. And their ability, we look at this and we're looking at about 42% of their pension check going just towards this health insurance plan. That means that people here in a couple of years are going to start looking at this and realize that they cannot retire even if they want to. They've given a career, they've given this time, and they're not going to be able to retire. So people deserve a well-deserved retirement after they've given that service, after they've given so much of their life. We need to be able to retire with dignity. So I want you to take a look at some of these pictures, whether EMS, whether fire, police. Some of those people will have the better insurance plan, some will not. How do you pick that person out? Those police officers right there, that's after the Nashville bombing. How do you tell one of them, say, oh, you're going to be able to retire and you'll be fine, but the other one, well, yeah, you're going to have to come up with 42% of your pension check to pay for your insurance policy. It's just not right. But we have time. This is the good news, is that the first crop of people that will become eligible is in 2023. Because those people, is anybody hired after July 1 of 2003, 20 years later, 2023. And as we go further down the road to the Tier 2 people and the Tier 3 people, they have a 25-year before they're eligible to retire, so there's a little bit of time to help them. But I also want you to think, like I mentioned, if you have somebody from one of these smaller communities that didn't make as high of a salary and has a much lower pension, how much more of that pension is going to be ate up by this health insurance? And then think forward to our Tier 3 people, anybody hired after 2014, this is going to be almost their entire pension check because their pension benefit is so much less than what the Tier 1 and Tier 2 enjoy. So we're going to be coming up against a very serious problem. You know, we joined this obviously for service to the community. That's how I've spent my entire adult life. I spent 8 years in the Marine Corps and the last 20 with the fire department. I've wanted to serve the community and serve the betterment of society. All I ask is a little bit of dignity in retirement. That's all any of us are looking for. So I want you to think seriously about this. Like I said, there is still time to act. I want to thank you so much, and I'll hand off to my comrade here.
Okay, I was asked to be here today to discuss increased Tier 1B, 2, and 3 retired firefighter health insurance costs and the associated impact on the fire service in Kentucky. As my friend Brian described, the retiree health insurance costs, which will start being felt by some public employees, retirees, as soon as 2023, are significant. So significant it pretty much negates the pension we are now offering as a real benefit. I'll emphasize once again that we are talking about firefighters in the fire service, but it pretty much applies to most all the public employees and employers of the Commonwealth. Over the years, it has been widely expressed that public employees typically receive lower pay in comparison to similar professions in the private sector, but that the lower pay was balanced by what many considered a better defined benefit pension program. For those public employees hired prior to July 1st, 2003, I agree with the intent of those statements. We do receive lower compensation and do have a better defined pension plan than most. If one is a Kentucky public employee hired since 2003, they are truly a community service servant working for lower pay and a minimal pension plan. Earlier this morning, you may have heard a presentation by the Kentucky Hospital Association during the Interim Joint Committee on Health, Welfare, and Family Services. That association is rightfully concerned about the critical problem facing Kentuckians. As they point out on an information sheet they have distributed, quote, on an all too frequent basis, ambulance service is not available to meet the needs of Kentucky's critically ill patients. There are many reasons that can be associated with this problem, and they may have some good ideas, but I suggest to you here that a root of this issue comes from low pay and lack of a good pension plan. During today's meeting, following us, you will hear a discussion of EMS Recruitment and Retention. You're going to hear from some great community servants representing my Fire Chiefs Association, the Kentucky League of Cities, and the Kentucky Board of Emergency Services. These professionals will talk about issues with the current certification and education process of paramedics in particular, and provide data relative to attrition of EMTs and paramedics. Out of all the information they will present, I suggest you notice that data from surveys of EMS professionals conducted by K-Beams will once again come back to low pay and lack of good pension plan. It will be noted that number one of the top 5 reasons survey participants let their EMS license certification to lapse was retirement. Number 2 was a low salary. Recruitment of individuals to join our fire service here in Kentucky becomes more difficult every day. Due to the lack of volunteer firefighters, which is another big issue in itself, fire departments have to cast a far net to recruit new trained employees. I was the fire chief of the Linden Fire Department until our merger with St. Matthews in 2018. The last 2 firefighters that I hired came from Richmond area and Madison County and Dayton, Ohio. The main reason we could entice these 2 trained firefighters to relocate to our community was due to a better pay and a top-notch work environment developed by an awesome fire chief. The firefighter we hired out of Ohio was a volunteer firefighter and graduated from EKU's fire service program looking for a career position. The Madison County firefighter located to us mainly due to increased pay and a more active service area. Pension was not a factor in his situation because he was in-state, thus making the pension portable. Because we could pay more, because we could pay more, what hole did that make in their former communities? Unfortunately for the rural communities in Kentucky, this goes on regularly. The urban, suburban areas near our largest cities in northern Kentucky, due to larger
Oh,
tax
I'm
bases.
telling you. I'll be right back in.
The larger tax bases are able to pay more and lure employees away from smaller and more rural areas. Firefighters and all public employees over the years have exhibited their passion to serve your constituents across the Commonwealth. Many have probably done this due to that passion, but they also knew they have a quality pension plan that would be there for them in retirement, making up for the reduced take-home pay in comparison to their private sector counterparts. As an administrator of a public agency, I understand that any change or adjustment to any KPPA plan could result in an increase in our actuarial required contribution. But I also know we cannot continue to sit back and do nothing. Therefore, I urge this legislative committee to study what can be done to at least adjust the health insurance credit system for all public employees who began serving our Commonwealth on or after July 1st, 2003. Thank you for your time.
This time, we'll open up to questions from members of the committee. Do I see questions from anybody on the committee at this time? Anyone participating virtually have a question either? Seeing none, thank you, gentlemen, for being here. We'll move on to the next topic now.
Thank you very much.
The next issue is EMS Recruitment and Retention. I'm going to split this up kind of in three ways as far as the group of presenters go. We will start with Keith Sanders, the Director of the Edmonson County EMS Service, and then we'll go with the KLC representatives in the second part of this part of the program, and finish up with our folks from K-Beams as the last part of this segment. Keith, if you'll introduce yourself for the record, and then you can proceed with your comments.
There we go. Sorry about that. My name is Keith Sanders. I'm the EMS Director for Edmonson County Ambulance Service located in Brownsville, Kentucky. Just to give you a brief background, I started in EMS in 1992, so I'm kind of a dinosaur, I guess, now. You don't see very many people staying in EMS that long anymore, and as the previous speakers addressed, that's part of the problem. There's a lot of problems, and a lot of them are intertwined. And to break them completely apart, I don't know that there is one total silver bullet to solve the issues, but there's some things that could be done to help the situation. And I'd like to just give you a little brief snapshot of what Edmonson County is. We're a small rural community. We do not have a local hospital. We do not even have a traffic light in our county. We're small. Population is about 12,000. Mammoth Cave National Park takes up probably 24% of the land mass, creating geographical barriers to response. We do not have the patient volume load of a lot of the larger services, which creates revenue problems. We have a lot of the same problems that everybody faces as far as finding folks, but we just don't have the pool to start with that a lot of places do. We currently minimally staff at one 24-hour truck and one 16-hour truck. That one 24-hour truck is a paramedic level truck. The 16-hour truck is usually an AEMT truck or a BLS EMT only truck, depending on what staffing I can get. We have a total of 8 full-time employees. The rest of them are PRN or part-time. Of those 8 that work regularly PRN and part-time, those folks, over half of them work other EMS agencies. Again, we get back to the topic of low pay, so they have to. Right now, staffing is one of the greatest challenges we face, partly because of the strain of the job itself. It's a physically demanding job. It is a stressful job. It is a very rewarding job if you want to do that. When I started in EMS, I started through the fire department. And to give you an idea of how things has changed, my EMT tuition didn't cost me anything. Because I was in the fire department, I was able to go to EMT class. All that was required was to pay for my books and go to the class. That's how I obtained my EMT certification. Went to work part-time for the ambulance service, eventually became full-time. Now, an EMT class is about $800 to $1,000, depending on tuition and books. An AEMT class is about $2,000, plus or minus, and books. A paramedic class, when I went through paramedic class, started in 2005, my paramedic tuition at Western Kentucky University was $3,000. Paramedic tuition today is anywhere from $8,000 to $10,000. Now, one of the things that really hinders is because most of the paramedic, or a lot of the paramedic and EMT programs are not taught through the university and college system, KEYS money cannot be used for that tuition. So we have a student that gets their EMT certification, wants to go to paramedic school, they cannot use any of their KEYS money if they're not going to a university or community college system program. And the way the education system is run, if it's an improved K-Beams TEI program, the licensure for a paramedic is the same regardless if they're going through Hopkinsville Fire Department, Frankfort Fire Department, or Sky Community College in Bowling Green. The licensure is the same. The tuition price has been driven, a lot of it, by the requirement by National Registry to have accredited paramedic programs. Is that necessary? Today, we see a lot of paramedics coming out that the programs today, in my opinion, are geared to make sure you pass the test. Functioning is a little bit different. But to recruit people, first off, you're causing them to pay a tremendous tuition out of their pocket to make barely above minimum wage. You know, there's been a push nationally and some places locally to move minimum wage to $15 an hour. Most EMTs start at 11 or 12. Why would you spend $1,000 to go take a class to make $11 an hour when you can go serve fast food and make $15? Same thing with paramedic. It costs you as much to go to paramedic school as it does to go to nursing school, but the pay is probably $10 or better an hour less. There's not a lot of incentive to move people into EMS because the money's not there. Why is the money not there? There's no the reimbursement. And like I said, it's a tied together thing. There's a lot of problems in it. One of the things that we're going to have to do is get the pay level up. And K-Beams will say, you know, they're trying to move the education to raise the level of education to drive the wages up. Well, that, in theory, I understand that concept, but by the same token, it's really hard to entice people to take the education if they cannot be shown that the money is going to be there when they've completed. You know, I come from a healthcare family. I've been in EMS that long. My wife is an RN, has been working at the Medical Center at Bowling Green since 1989. My daughter's a flight nurse in Harlan, Kentucky, and my son is an EMT, works part-time, and is planning on pursuing paramedic. I got into this because I love what I do. I didn't get into it for the money. And you'll find that most people that stay in EMS very long anymore, they have to love what they do because the money won't keep them there. Now, how do we solve that? If I had to answer that question, I would probably be in a lot better position than I am today. There is no silver bullets, and I understand that. But to the obtaining the certification, we have, the way it's set up now, it is so hard for people to get into it, cost prohibitive, and the way that the testing programs are run, it discourages folks from pursuing it. There is a lot of misconception of what EMS can and does do. You know, a lot of people are still under the notion that we show up, throw a patient in the back of the truck, haul them to the hospital, and that's the end of it. You know, we are, for most places, if you're running an ALS service, you're basically a rolling emergency room. And we can do a lot of the same things short of surgery, but if you have a cardiac arrest, we're going to do basically the same thing for you in the back of that truck that a ER is going to do for you there. Misconceptions of what we can do, I think, drives the fact of, well, maybe why should they be paid this? All they're doing is hauling somebody to the hospital. We are healthcare providers. CMS classifies ambulance services as providers of transportation, and that's how they reimburse. We are part of the healthcare program. We're the beginning of it. You know, during the pandemic, how many times do people arrive at a hospital by ambulance because, you know, they've called, their symptoms are worsening, whatever, they don't know what else to do, so they call us. There has to be people, you can have the best equipment, you can have the best ambulances, but if you don't have people on those trucks to roll them, they're not doing a lot of good sitting in a bay. Staffing, if something is not done to address staffing and draw people into this and keep them there, the EMS system in Kentucky is in danger of collapsing, in my opinion. It's in a dire situation. Right now, in our region, agencies are stretched to the point, I've talked to my fellow directors, we have no cushion for error. If we run out of trucks, regs, the current regs we call for mutual aid from surrounding county, we're required to have mutual aid agreements. We have them with every county that touches us. But just because I have those agreements does not mean that county is going to have a truck to send me. We routinely have times where we cannot get mutual aid. Everybody is stretched that thin. Now, this is not something new, and it's not due to COVID. We've been stretched this thin for quite a while. I don't know the answers. I wish I did. Another thing that I think that would help, and I don't know what this committee can do other than make a recommendation stuff, there are two other issues that would help staffing, in my opinion. One would help recruitment, the other would help staffing in general. The one thing, if we could bridge between advanced EMT and paramedic. Right now, you can go to EMT school, you go to paramedic school, or you can go to EMT school, you can go to advanced EMT school. But you can't, once you go from EMT to advanced, you have to back up and go from the base back through to go to paramedic. That training that you take and the coursework you go through to go from basic to advanced doesn't count to get you on into paramedic. There is no bridging there. That needs to be put in place. I don't know how that needs to work. That would be a job for K-Beams to figure out. But that needs to be done. That would allow, you could show a pathway then to prospective employees, to students in high school. We try to do a lot of work with our high school to entice students into it. But you can show them that there's a path you can go from EMT to AMT to paramedic and bridge on into nursing, go to get your nurse practitioner. A pathway that they can get somewhere to make a career, whether they stay in EMS the whole time or not. You know, you can get your nursing degree and still stay in EMS if you want to. But a lot of students do not see that, and it's hard to explain it to them, because there is no direct path a lot of times to do this. Another thing that needs to be looked at that would really help in Kentucky is the reemployment of retired paramedics. If you're in a CRS system, as Edmonson County is, if our paramedics retire, they cannot come back and work post-retirement more than 100 hours without penalizing the agency and the employee. Kentucky State Police has what they call a Trooper R program. There could be something set up similar in the state of Kentucky that would allow paramedics that have retired that want to come back and work a truck to do that without any penalty. They wouldn't have to put it back in the retirement system. Let them just come staff a truck, pay them to be on the truck, and let them take care of patients. There's a need out there for paramedics to be in a truck. And when we have people out there that could do that, but because of some of these laws and restrictions that we have, we're not allowed to use them, that's a problem. It's a problem. And to me, it's an obvious problem. I don't know what it takes to get that addressed, but it's something that needs to be looked at. The problem we have with getting people in it, I don't have a solution. Till we can show people that you can make a living working in EMS, it's going to be hard to do. We're a small county. We are funded by a taxing district. We receive no additional funding from fiscal court other than the property taxes and our billing. Our budget runs almost a break even between expenses and revenue every year. We have very little of a contingency fund, so we can't compete with increasing salaries from surrounding agencies. So as everybody else can come, if they can come up, we're kind of hindered. Right now, a paramedic, if I've got a hazardous duty paramedic, it costs me about $25 an hour to pay that paramedic versus $18, $20 an hour for comparative pay because of the retirement. That's another problem. Like I said, there is no single problem. There probably is no single solution, but there are a couple of things we can do. We can address tuition cost. We can allow KEYS money to be used toward tuition cost. We can look at bridging the pathway, showing students that there is a career in EMS long-term, not just as a stepping stone into something else, but that they can get in EMS and do that. They can serve their communities. Most of the folks when I started were involved in volunteer fire departments, and they lived and worked in Edmonson County. Now, a third of my staff or more live 45 minutes to an hour away. But why? Because we can't get people involved. The gentleman spoke about the problem with volunteer fire departments. Chairman Meredith's dad and I have had this discussion several times. It's hard to get volunteers anymore. When our generation of folks step out of it, kind of looking bleak for the future of it. EMS is kind of the same way. The people that are in it and have been in it for years were in it for the passion of the job and because they love serving people. But there comes a time, regardless of how much you love the job, you have to put food on the table. You've got to take care of your family. You've got to look out for your long-term interest. How do we solve that? It's a good question. Thank you all for the opportunity to be here. And if you're ever in Edmonson County, stop in and see us.
Thanks, Keith. Any questions from members of the committee? Representative McCormick.
I actually supplement Tim. I pay his tuition. I know all the problems they're facing without, you're not eligible for the government funding for all those programs. But we have literally have to get the pay up. We've got to get the reimbursement rate higher for this, because when you have a medical emergency, the bottom line starts with an EMT, a paramedic, or an ambulance service. So you reach out to me anytime, let me know what I can do, and you know, it is something that we can't just sit on, because this has been going on for far too long. And his part-time job, he works 60 hours a week. He goes in on Friday evenings and comes off on Sunday evenings, and if he's in the middle of a transport to Mayo Clinic or Louisville or whatever, you know, he won't get off until Monday morning. So I know where you're going. I know where you've been. You know, the hazards of the job is great too. It's not, I'm almost thinking they probably should have hazardous duty. You know, he was recently, his face was spit, his eyes, everything was spit full of sputum from someone that was drug impaired, severely drug impaired, and having a seizure, et cetera. So, you know, you're correct when you say that, you know, they are a rolling emergency room, because they are. They have to triage these people all the time. I could go on and on, but I'll stop for now. And thank you for what you've done for the people. We do have to recruit and retain people in this industry. So reach out to me for anything that I can do to assist all of the EMS service. Thank you.
Thank you.
Representative Brown.
Thank you, Mr. Chairman. Director Sanders, your presentation was very insightful and comprehensive. I think that goes from pay issues to training, EMS, paramedics, and training, and reemployment. There appears that there's some things in there that we may be able to assist with legislation. If you could get some information to the staff of this committee, maybe we can start to draft some legislation that will address some of your needs. I was particularly informed by your information about reemployment. And there may be definitely something that we can do with that, because if we have people out there that have the expertise, don't need to be retrained, but because of retirement benefits or Social Security, that maybe they can't be reemployed. Maybe we can address that with legislation and get some qualified, capable people into the field. And as you said, and as my colleague just mentioned, that EMS units are rolling emergency rooms. I had an experience with that this summer, so it's personal, and I certainly would like to get more information as to how we can help with some of the issues that you're bringing forward. Thank you very much for your presentation.
Thank you, sir.
Senator Alvarado.
Thank you, Mr. Chairman. Thank you, Mr. Sanders, for your presentation. Just real quickly, just from a practical standpoint, I'm sure you guys make, let's say your service, you're in a small county, you don't have a regional hospital inside your county, so where do you normally take your patient runs to? I mean, Warren County is probably close by. And
Warren County, Barron County, and Grayson County.
so if you make a run to some of those hospitals, let's say Warren, for example, if you go there, you drop off a patient, if that person has to go back home, let's say you've dropped them off to the valley and they got to go back home, do you get that run to go back to your county?
It depends. If you're, I assume you're talking about medically necessary transports.
Well, yeah,
yes.
I mean,
yes.
let's say you drop somebody off.
Yeah.
Do they normally call you back, or
Yeah.
do they use other services to do that?
Right now, in Medical Center and Greenview both are calling us. We kind of have an informal agreement. Now, they are calling us from the ER. Patients on the floor most of the time we're getting called. Now, if it's, for example, if it's in Warren County and it is at Sky Rehab and it's an Evanston County residence, most of those times we're not getting called to transport those folks back, even though they pay taxes and support our ambulance service. The run, they're calling Med Center Dispatch and Med Center makes those transports. Now, if Med Center Dispatch calls us, then we will take, if we have staff available at the time.
What's the impact, I mean, financially for you all when that doesn't happen?
When that doesn't happen, well, to give you a real brief example, it's been about 4 years ago. We extended a 8-hour day truck to a 16-hour shift. The cost between the reduction in call-in for overtime and the increased revenue by being able to pick up the return transports pretty much netted out the cost of adding that 8-hour truck. So, and that was roughly around $100,000 at that time. It's, if we do not have the returns, it's an impact on the bottom line. Now, that being said, everybody knows reimbursement with Medicaid is a challenge, especially non-emergency Medicaid. You know, $80 is that, but if my truck costs me the same dollar amount to sit there versus making a run, other than the fuel, basically. So if I can be moving patients with that truck, it reduces my cost per run, if that follows, versus just sitting there. Now, it does not usually, the way we staff and the way we run, we kind of coordinate that. We do not send trucks out to pick up non-emergency runs without another truck being available for emergency calls. So we do staff to mitigate the impact on emergency response. But from a bottom line, if we wasn't allowed to make those runs, it would we would probably be operating in the red most of the time without doing tax increases annually.
Thank you. I'm just curious, if you're not getting those returns, that sounds like it hits your bottom, you're saying around $100,000. That's what I needed to know. Thank you. Thank you, Mr. Chairman.
And Senator Alvarado, you know the Medicaid area probably as well as about anybody in this room does, certainly, but
yeah.
We have it's kind of what would be considered a statistical oddity in our area, and I'm sure it affects some other areas in the Commonwealth as well. As the director mentioned, we don't have a stoplight, we don't have a Walmart, we don't have a McDonald's, but we're considered an urban area for Medicaid reimbursement
and Medicare
in our county. And so that's another thing that affects the rates that they are able to charge in the service just because of the federal designation with regard to Medicaid. Okay. Any other questions from members of the committee? Seeing none, thank you, Keith.
Thank you.
Move on to KLC's group of presenters. I think we have folks from both KLC and the Fire Chiefs Association coordinating together on that. Recognize yourselves for the record and then proceed with your testimony, please.
I'm Brianna Carroll, Director of Public Affairs for the Kentucky League of Cities.
I'm Mike Sutt, Deputy Fire Chief, Anchorage, Middletown Fire and EMS, and representing Kentucky Association of Fire Chiefs.
Les Stapleton, Mayor of Prestonsburg.
We are here today to update you on an ongoing problem that's impacting our health and welfare of our citizens. We first testified in July of 2019 before this committee about the issue of paramedic shortage. We have focused on the limited training issues, the time, the cost of the accreditation, which is combined creates the problem that we're facing now. Our cities are continuing to report those same concerns. Cities often pay the cost of training only to have the newly certified paramedics leave for a higher paying job in the private sector. To exacerbate the issue, the state has shifted that paramedic training into more of a college setting rather than the previous vocational focus. Anchorage Middletown Fire and EMS Deputy Chief of Operations Lieutenant Colonel Mike Sutt is here with me today to provide more information on how the training requirements work.
Thank you, ma'am. I appreciate your all's time today. But basically want to enlighten you how this system works and the issue that it has created for us. Currently, only 4 local governments are currently operating paramedic sites to train their own EMS personnel. At one time, that number was 25 to 30. and now there's only 13 sites statewide. It takes approximately 2,000 hours of training for an emergency medical responder to become a paramedic, which is a huge commitment. Working EMTs often struggle to find the time to attend paramedic school because of their current jobs that they're working or somewhere else. Cost is also a huge deterrent that we are coming into, that an 18-month paramedic program costs approximately $9,000 currently at KCTCS. Over a 4-year period, from 2016 to 2020, Kentucky programs document 448 initial paramedics from programs within our current education infrastructure. When you consider there are 120 counties in Kentucky, that's only 4 per county, so you see our struggle. Additional challenge is Kentucky uses the National Registry of Emergency Medical Technicians as the state's sole certifying exam site. Some states don't even require this. Once paramedics are certified, many choose to move off of the ambulance for increased pay, better retirement, and career advancement that you've heard today. This can skew Kentucky's numbers as many certified paramedics do not work on the ambulance themselves. KLC data shows that outside of Louisville, only about 9% of paramedics employed by cities do not also serve as a firefighter. What we are seeking is an assessment of Kentucky's current educational infrastructure to determine if our current system of training and certifying paramedics is truly serving our needs, capable of keeping up with our demand, and working for the overall safety of the public. Having college institutions do the training does us no good if paramedics are not available for 911 calls and other responses when the public needs them. This time I'd like to introduce Mayor Stapleton.
My name's Les Stapleton, Mayor of Prestonburg, Kentucky. And Mr. Chairman, the committee, I appreciate y'all giving me the opportunity to come and speak with you all. You know, knowledgeable and skilled personnel is important. It's even more important on an ambulance. The thing is, I have a fire department, and we have 28 personnel who are either EMT or paramedics. They work for me because I have retirement, I have benefits, and I pay better. Even if they work the 24-hour shift with us, they don't have a desire to go out and work a 12, 24, or maybe even a 48-hour shift with another group, with another ambulance service. They don't have to because they're making a livable wage with us. So I got to back up and tell you, I'm a retired state police, and when I did investigations, there was 4 questions I always answered. It was how, what, when, and why. And I'm here to tell you about the why more than anything. In the city of Prestonsburg, we have had such a lack of personnel in the private industry that we cannot get service sometimes. We have to actually call Paintsville, which is 20 minutes down the road, and ask for mutual aid, much like Edmonson County does. We've had to ask for mutual aid from Pikeville on occasions, which is almost 40 minutes away. So when we get a call, my EMTs and my paramedics running our squad truck are there within 3 minutes. So in 3 minutes, they're on the scene extricating, they're on the scene triaging, and they're on the scene packaging. And then we're sitting in the middle of the road with a 70-year-old woman's head in your lap and 40-degree weather, and her laying there waiting on the ambulance to come and pick her up. So these gentlemen and K-beams and a lot of people have a lot more knowledge about how we're going to solve this problem. But the why is we literally have people dying out there right now. The lack of personnel, and you know, a lot of people want to say that you can go forward and you could put more ambulance services in, but then all you're doing is spreading the same personnel out over different agencies. And a lot of them will work both agencies. And then you have personnel that is on their last, just wore out, on their last draw. So you got to be careful about that also. I suggested this to Brianna, and I really appreciate her and KLC listening to me on this. County and city governments, local governments should have an opportunity, if it's declared an emergency situation, they should be able to bypass the CON process and go straight to the K-beam's licensing process. If they are licensed by K-beam, then they have the adequate needs, they can fill the adequate needs that needs to be there. They have the resources, they even have to have the money behind it. On January 24th, 2020, the city of Prestonsburg applied for a CON. I have yet to have a hearing. I have people dying. I literally have a book about this big of CAD reports, which is our 911 reports, which will tell you when it took over 10 minutes for them to arrive on the scene. I didn't really feel like carrying that around down here, so I just went with the last 30 days. That's the last 30 days. When it takes over 10 minutes for somebody to get there, when my people there are there in 3 minutes and solving this problem. Now, on the COM process or bypass I was discussing, I don't think it needs to be for transports. I don't think it needs to be for doctor's visits. I don't think it needs to be for non-emergency situations. It needs to be for emergency calls only. Sometime within a year, I think they should go through the COM process and make sure that it was actual an emergency and a need. I don't want to do away with the system because I see some value in it. But I do think we have to do something to allow our local governments, the citizens of Prestonsburg pay taxes. They deserve the service. And when we're sitting there, when I have a fireman sitting there with someone doing CPR for 41 minutes while their family's sitting there looking at them, waiting on an ambulance to come from 2 counties away, it's emergency. We got to find some way of getting through that. The governor just declared an emergency, and he has brought 2 strike teams for transports in. I'm going to submit to you right now that in rural Kentucky, right now, it's been an emergency like that for the last 10 years. We need some help, we need some oversight, and we've got to find some way of solving this problem. Thank you.
Questions from members of the committee? Senator Nemes.
Yes, thank you for being here. And, I'm a big advocate for the fire departments. But in Bullitt County, our judge exec, he says there's a great need for CONs. I'm glad that you say that there is some need for it, that you don't want to abolish them altogether. The speed of how you get them, the red tape, we all agree we need to do away with that. But in Bullitt County, we had a problem just like everywhere else, not enough ambulances. So our judge did a great job of investing in not only just the ambulances, but in EMTs. He started an apprenticeship program for them, which may help other counties if they want to send them to Bullitt to get trained. So I would advise any judge exec to call him and see if maybe he can help you out on how to do these things. So the CON, I think that is something necessary, because if you start having too many fire departments close, I know most of y'all have counties that are far apart and are different, but if you have too many and they're fighting with a government, the county judge or the county that has invested his money in that, and then the other ones come in there, they won't want to invest their money if they're not going to not get a return, but if it's going to cost them and everybody else is taking their EMTs away from them and running the calls.
May I respond?
I would appreciate your answer, yes.
Okay. 2 things is, one is on our fire department, we have a total of 27 either EMTs or paramedics or advanced EMTs that we could put on the scene in 3 minutes. We work 6 people per shift, and we're a very small town. We have 2 stations, one on each end of town, so we can access quickly and effectively. The COM process, and when I was in the state police, I literally remember 2 ambulance services. The drivers got out and were fighting at the scene as to who got there first. So I understand the COM process. We don't need that. But if a city or county government can look at a situation and say we're in an emergency situation, we can declare emergency when there's a flood and it's endangering people's lives. We should be able to declare an emergency when people are dying in their homes because they can't get transported to the hospital. And I never did say do away with the COM process. I think it should be bypassed and allow us to go to the licensing process. And then if it backs up, we go to the CON, they say you didn't need that, you're just trying to make money. And from what I understand, it doesn't make money.
I think we're in agreement. We're saying pretty much the same thing.
Yes, sir.
The CON needs to be quicker, and if there's a need immediately, we can do the license with the CON backing up.
Yes, sir, I agree. One other statement, if I could. It was brought to my attention just a little while ago, on September the 30th. K-Beams came out with an emergency declaration, an emergency directive that allowed non-EMTs or paramedics to drive an ambulance. That's just to drive an ambulance. They help load them up and they drive them. I think the restrictions was they had to have a CPR or a basic first aid. So they did not have to be EMT or paramedic. And September the 30th, that is expiring. That's going to take more EMTs and paramedics and put them behind the wheels of vehicles when they will be working the back of the buggies.
Very good point. Our judge exec also mentioned that for the cost of that. But I think that what he's doing with the apprenticeship program and working in the high schools and that, I know it's working, and it can help with other counties also.
Yes, sir.
Other questions? Representative Miller?
An earlier speaker mentioned about expanding the use of KEYS money for people that are not going into conventional facility or educational institutions. Would you advocate for that?
Yes, sir, I would. I have two sons. One of them's college educated and got a degree, and he went into his field. The other one did not want to go to college, and he took some training in an apprenticeship program that I would have loved to be able to use that KEYS program to put him into it. Now, the same thing goes with EMTs and paramedics. If we can help these people that are interested in this field get that training, it's going to make a substantial impact in our personnel across the state.
Senator Wheeler?
Thank you, Mr. Chairman. Mayor, thank you for coming down here today. It's always good to see you. You know, I think you hit on a subject that, as a senator for a very large rural district and actually for the largest county land-wise in the Commonwealth of Kentucky, is really impacting the safety of our rural citizens. You know, my father-in-law has lived for, 50 years in his home in Elkhorn City. I know you're very familiar with him, being a native of there. But, you know, he's 91 years old, and, you know, there's really no ambulance that's, I think, currently in Elkhorn City. They have to send one from, another area over there. And, it just becomes an extreme problem with the expense. I think since Elkhorn Ambulance Service closed, they've not had a permanent service there, and I think that's a problem that we're seeing all over eastern Kentucky. At the same time, I have my healthcare institutions telling me that there's a problem with just basic transport because of the need to have a certain number of people on call for emergencies, that they can't get a transport from one healthcare facility to another. But then you'll have the ambulance services kind of say, for lack of a better term, that's the easy money, whereas, we lose money when we have to make some emergency calls. What are some of the solutions that you would see to kind of, in addition to the apprenticeship programs, which I think are a wonderful idea, what are some of the other solutions do you see that we could do to provide more service for smaller rural communities?
Well, I was fortunate enough to be able to speak in front of another committee earlier in the week about volunteer firemen. Volunteer firemen are very valuable. Most of them become EMTs through their service and will work with ambulance services, because most volunteer agencies will help them get the education, help them get the EMT training. That's an excellent opportunity if we can make it at least. It doesn't have to be, they don't have to make money, but if we can keep them having to lose money for all this time to be able to get that training and be able to work with these volunteer fire departments, I think we could really move our personnel up that way.
And I agree with you, and I think I'm familiar with that bill. In fact, I think I filed it a couple sessions ago, and I'm glad to see that it's getting some traction this time. I think that the volunteer firemen will be a really big assistance to providing some of these emergency services to rural areas.
Senator Alvarado.
Thank you, Mr. Chairman. Just really quickly, I think we're one of only 4 states that actually has CON requirements, period, for ground ambulance. I think it's Arizona, New York, Hawaii, I think, and us, and that's it. I don't know that any of our neighboring states have this requirement. So I think that's something for everybody on really in the committee to know, that we're kind of outliers on this as far as how this is being handled. I know we talk about cities making determinations if someone needs an ambulance service or not. I mean, a lot of our hospitals also need that requirement, I think, sometimes too. And hospitals, we heard testimonies in the committee before this about difficulties they're having of people sitting in hospitals waiting for someone to be transported to another facility. And the doctor there, who's more trained than any of us are, right, or than most of us at least are, to be able to call that shot to determine if that person this is an emergency transport, a non-emergency transport, whatever. I think there's a proposal being done to have kind of a non-substantive review for CON, to your point that you've been waiting a long time to have this done, that if we change the process for that, it would require a hearing within 45 days, mandated to be done within that period of time. It might be something we want to start taking a look at also. Another question just from, I think K-Beams, you were mentioning the regulation that had gone away. That was kind of an emergency reg that we allowed non-EMT people to help drive those. I thought there was a regulation, maybe it's the same one, where they would allow nurses to be able to fill in to help ride in a buggy. So if someone's being transported, if a nurse was there and you didn't have enough, they could be the ones to go along just to handle the shortage as people were being taken to the next location. To see if that was an option. And I think K-Beams got rid of that, if I'm not mistaken. And I don't know if that expired from the reg or if K-Beams actually removed that as an option.
I am not sure on that, sir.
Yeah, that might be something for us to talk to those guys to see, because if that's the case, probably not a good idea when we're running short on personnel. But those are some things for us, I think, to consider, is that there's a proposal out there that's floating around to help expedite this process. And then the question just becomes, do we even need to have this, and it's always a very touchy subject when it comes to CON. Like you said, you don't want people fighting on the streets for the privilege of transporting somebody, but, that's the reality that we live in, really, compared to the rest of the states and our neighboring states in the country.
Mr. Chairman, if I may, my thoughts on that, the CON process does what it's supposed to do. Because if you flood the market with 5 or 6 different agencies in these small rural counties, eventually everybody's going to start losing money. They're going to start pulling back out, and then there's a vacuum left there. There's no personnel there. So I agree that there is a use for the CON process, and I do understand that. But we have to expedite it or allow county and city governments who see a 911 emergencies. We're talking about 911 calls only. I'm not talking about transports. They need to be able to protect their citizens. They really do.
All right, thank you all very much. I think our last presenters are virtual, from K-Beams, Mike Pointer and Chuck O'Neill.
Yes, sir. Thank you, Mr. Chair. Mike Pointer, I am the Executive Director for the Board of EMS. And I will say that I was fortunate to start my career in 1980 in Barron County, which is adjacent to Edmonson County. So I totally understand Director Sanders' concerns with that. So we apologize for not being in person. We were just notified by FEMA that we're responsible for deploying some EMS assets that we have requested this week. So our apologies with that. And with that, I'll introduce our other speaker, Chuck O'Neill, our Deputy Executive Director. Chuck.
Afternoon, Chairman, and to the rest of the committee and our friends, Director Edmondson, Director Sanders, Ms. Carroll, Mayor Stapleton, and Mr. Sutt. We've got just a few slides to go over today. Can you guys hear me in the room okay?
We can hear you, Chuck.
Okay. I'm going to try to share my screen here if it'll work. Y'all see that in the room okay, Mr. Chair?
Not yet.
Okay.
Got it now.
Great, thank you. This will just take a few minutes here. Hopefully this will answer some of your questions, but we do appreciate you all having us in today. And again, as Mr. Pointer described, we're expecting about 3 ambulance strike teams from FEMA to come and assist us in the state in the next 24 hours. And we're kind of stuck in Lexington and in the Louisville area. It looks like we may end up going back and forth to try to help coordinate that. So we're going to talk through just some of the recruitment and retention issues that we've identified through research and questioning EMS providers and professionals in the field in Kentucky. Problem statement: Kentucky, as well as states across the nation, are experiencing a shortage of appropriately trained and credentialed EMTs and paramedics. Lack of EMS personnel availability on ground ambulances place the health and safety of the citizens of Kentucky at risk, also reducing the capacity of ground ambulance availability for interfacility transfers. As Mayor Stapleton mentioned earlier, his primary concern is providing emergency service for the citizens. If you listen to members of the Kentucky Hospital Association, their primary issue is with interfacility transfer. So the lack of personnel is causing us issues on both sides. A recent study by the Kentucky Board of EMS shows that while we have over 14,500 EMS professionals certified and licensed in Kentucky, only approximately 50% of these individuals are employed by a ground ambulance service in Kentucky. In 2018, KBEMS, in collaboration with the KBEMS Education Committee, the Kentucky Association of Fire Chiefs, formed a paramedic accreditation task force to allow for the flow of information across paramedic educational programs. One of the work products of this task force was to survey certified EMTs in Kentucky, EMTs that are already functioning and certified in Kentucky at the EMT level, and to identify perceived barriers to completing paramedic education. The top 5 barriers identified by those EMTs that responded to the survey were 22% was a work and school schedules conflict. 18% was no desire to become a paramedic. 17% was time commitment, length of service. 14% was little increase or incentive pay, and 12% lack of financial aid availability for those programs. We also perform attrition reports annually. We haven't in the last couple of years because we've been staffing the state EOC as part of COVID-19. So our daily operations and our annual reports have gotten behind just a little bit. But to better understand provider turnover and conduct provider retention efforts, we began studying EMS attrition in 2016. The top 5 reasons, as the gentleman spoke of earlier, the top 5 reasons for allowing an EMS license or certification to expire in 2016 were retirement, 26%, which we want through our attrition reports. We want retirement to always be the top level. We want the highest percentage to always be retirement. That means that individuals are staying in the profession until retirement. The 26% at retirement, low salary and poor benefits package, 24% of the individuals that allow their certification or licensed to lapse in 2016 stated low salary and poor benefits package. 16% relocated. 10% responded to external factors or not their choice to leave EMS, and 10% reported poor management and or hostile workplace as their reasons. And hopefully you have our 16, 17, and 18 attrition reports in your packets. So competition is what we're dealing with. This is the Interim Committee on Local Government, and we speak with local governments and local ambulance administrators daily. We're happy to help, but just like Director Sanders stated, there's not a silver bullet to fix the issue, but competition is real, and it exists. Ground ambulance services operated in both the public and private sector are having significant difficulty competing with hospitals for paramedics. Hospitals are offering significant sign-on bonuses and hazard pay that local governments simply cannot afford currently. Just for instance, we'll look at some salaries in just a second, but UK Healthcare on the left here, this is from Simply Hired, paying up to $30.09 an hour for paramedics. Jenny Stewart Hospital in Hopkinsville down in Western Kentucky offering a $15,000 sign-on bonus for paramedics in the emergency room. Local governments are going to have a really hard time. City and county local governments are going to have a really hard time competing with that. Action items. These are some things that we have done or that we can do, we believe, to help. House Bill 8 was enacted by the General Assembly in 2018. This bill bolsters Kentucky Medicaid ground ambulance reimbursement by generating an additional $43 million each year earmarked for Kentucky ground ambulance services. What we found so far, this program has started in 2021. It was enacted in 2018, but it actually started. I have meetings with a group that runs the program at Medicaid every couple of weeks, and the distribution has begun. What happens, though, in several of these instances is the county or city-operated ambulance services get these lump sums of Medicaid money to assist with operations, and they end up getting dumped into the county or the city's general fund rather than reallocated to the ambulance service. So I would recommend that the dollars, the 43 million additional Medicaid dollars, should be earmarked by local governments to enhance EMS salaries, benefits, and also student loan forgiveness programs. Many of our younger EMS candidates that we talk to, kids that are in their teens and 20s coming out, are interested in non-traditional schedules. Agencies and local governments should evaluate the continued use of 24-hour shifts for crew safety and staff retention. When I came up as a paramedic, I've been a paramedic for 21 years, and I wanted to work the 24-hour shifts. But the younger generation is not as interested in the 24-hour shifts as I was. We should also evaluate upward mobility options for EMS staff. Many rural and even suburban agencies don't have large administrative organizations, and opportunities for advancement are limited or non-existent in third service EMS programs. I believe we should also support federal and state student loan forgiveness programs for EMS personnel. We have I'm enrolled in the federal public services loan forgiveness program, but you have to pay the loans for 10 years before you get any forgiveness on those. Threats to the citizens and to our EMS programs in cities and counties across the Commonwealth. The 2019 Kentucky EMS Salary Survey produced the following summary results for starting EMS pay, and hopefully you all can see these. EMT, the average was $11.88. Advanced EMT was $13.30. Paramedic, $15.62. And that was 2 years ago. Those probably haven't moved a lot. And on a previous slide, you saw that, for instance, UK Hospital emergency rooms paying up to double that, along with sign-on bonuses that hospitals are offering. Consistent themes in EMS across the nation is that our EMS providers will no longer do the work for the compensation packages that are available or being offered. Local governments must find revenue streams to significantly enhance EMS salary and benefit packages to remain competitive in the market. Additional areas that we might be able to take action on at a local level or assist at a state level: child care assistance for single parents working 24-hour shifts, EMS mental health services, wellness initiatives, alternative retirement plans. I know this is not an easy ask, but as many of my colleagues in fire and EMS would probably agree, CERS, hazardous, and non-hazardous plans are no longer an effective recruitment or retention tool for us. Evaluation of alternate accreditation programs for EMS educational programs. I think we definitely need to evaluate alternatives to the current accreditation programs offered by COA and required by the National Registry for testing, and educational and financial incentives for continued work in the ground ambulance sector. We see so many paramedics going to air ambulances and to hospitals and things like that. And like the previous slide stated, only approximately 48 to 50% of our certified and licensed individuals are actually continuing to work on a ground ambulance. So that's all I have, and myself and Mr. Pointer will be glad to answer any questions that you may have, Mr. Chair.
Thank you, Chuck. Questions from members of the committee at this time? Senator Alvarado, you might want to follow up the question that you asked the last time to K-beams.
Sure. So the one was with K-beams. I know there was a regulation that was as far as allowing other staff, like nurses, to ride on buggies, and that was removed. And I'm not sure why. So we're in a time of shortage when we have a need to have somebody accompany a patient, and then somebody's being transported for some other reason, that there were nurses available or a nurse willing to go with the patient, that could serve as someone. My understanding is that K-beams removed that reg altogether. And so I was just inquiring as to why that was in a time when we're short on staff.
Sure. I can take that, Senator Alvarado, and thank you for the question. Our attorneys actually reviewed this a few years ago, and we did an advisory opinion on it. So it's our belief that a nurse or a respiratory therapist or a physician can be the attendant on an interfacility transfer through EMTALA. So we believe, and our attorneys believe, that federal regulation through EMTALA preempts any state regulation over allowing a physician who's already mandated through EMTALA to ensure appropriate staff, equipment, and transport method for a patient that's being referred to another facility. So we believe that our laws are actually preempted, so we don't discourage or regulate those EMTALA type situations. As far as nurses working on ground ambulances in an emergency setting, we don't have anything like that in regulation. Some of the emergency orders that we were discussing earlier that Mayor Stapleton was discussing were part of our authorities granted under Senate Bill 150, which we believe is part of what the Supreme Court overturned on Saturday. So those emergency orders are probably going to be getting scaled back very soon.
You know, and I understand with the Senate Bill 150 and some of the executive orders and things we've extended in the past with House Joint Resolution 77, you're telling me that your attorneys think that if an ER doctor wanted to accompany a patient on a buggy, that they think that violates federal law? Because, I mean...
No, sir. No, sir. No, sir. Under EMTALA, the referring physician is responsible, obviously, for the mode, the appropriate staffing and equipment for the patient. So we believe, and our attorneys believe, that it is not illegal in Kentucky at all to put any staff equipment or vehicles in place to appropriately transfer that patient. We believe that federal law under EMTALA supersedes any state law that we could put in place to say that nurses can or cannot accompany a patient on an interfacility transfer. We believe that that's under federal law, that is the responsibility and the authority of the referring physician under EMTALA.
Right. So, okay, so back to my original question. So you had a reg. If nurses wanted, to allow a nurse to accompany a patient, let's say you guys were down on staff, but a nurse is willing to go from an ER, who's well-versed on running codes, administering emergent medications, running drips, IV fluids, an ER doctor who might be willing to accompany a patient for some reason, can do procedures en route if needed. There was a regulation that allowed those individuals to go with your EMT folks on a buggy, and that reg, from what I understand, has been removed. So you're telling me, okay, federal law supersedes EMTALA. I'm very familiar with EMTALA, and that's all regarding transfers of someone going to another facility. Why would the reg be removed to allow staff? I'm not clear with your response, because you're telling me in one that it was federal, and you're saying, well, it supersedes our laws. Is that why the reg was changed? Because you think that federal law prohibits those folks from accompanying somebody en route?
No, not at all. Not at all. And I'm not familiar with any regulation that we've had regarding nurses on an ambulance other than Class 3 critical care interfacility transfers. But we encourage it. We encourage nurses or respiratory therapists to be utilized. And I'm not aware of any regulation that we've had since I've been here in the last 8 or 9 years that discussed it, except for specialty care transports. And that's a Class 3 license. It's a little bit different.
Why would it be limited in that case?
Specialty care transports or Class 3s are similar. The UK Neonatal and Pediatric Transport Program, Norton Pediatric and neonatal programs, they use specialty RNs usually that are from the NICU for those programs. So adult critical care transport, pediatric critical care transport, and neonatal critical care transport are all under our Class 3 specialty care licenses. Specific staffing, minimum staffing requirements require a nurse or respiratory therapist, a physician, a PA, a nurse practitioner, et cetera, in addition to an EMT and a paramedic on those specialty teams.
Other questions from members of the committee? Chuck, one final thing, just a couple of things that were mentioned prior in the presentation with regard to the possibility of us looking at, because we've looked at it across the board on other things, the KEYS money being used for programs that are not in the community college setting or the university setting. Could you all weigh in on that? And also on the reemployment issue of certified paramedics?
Sure. I think Chairman, we definitely endorse the KEYS money being used for EMT programs. Because many of the paramedic programs are already affiliated with a college, they can use KEYS money for that. But I think what we were discussing is KEYS money being used for EMT programs. And I believe, I may be incorrect, but some of our EMT programs, or many of our EMT programs, are offered through State Fire and Rescue Training, who's affiliated with KCTCS. So there may be a possibility where some legislation could be written to allow KEYS money to be used through that because they're affiliated. I believe that the KEYS program requires that it be through a college or university or an accredited technical school in order for those monies to be used. But anything that we could do to assist with the power that we have, we would definitely endorse and advocate for KEYS money to be used for EMS programs. Definitely. And what was your second question, sir?
Second question was on the reemployment issue on certified retired paramedics. Would you all weigh in on that too?
Yeah.
I can take that, Mr. Chair. Last year, in the enact of the emergency regulations by the governor, they authorized us to modify our regulations. We got together with our leadership team and tried to decide what's the best way to do that. One route that we took was anybody that has ever been certified or licensed as an EMT, first responder, or paramedic, or advanced EMT in Kentucky, during the emergency regs, we allowed them to come back full status at no charge and be fully reinstated. At that point, we were thoroughly surprised that we had over 1,000 first responders come back online. So that was not only, for the state of emergency, but also for, recruitment for the future too. So I hope that answers your question.
Will the regs, the emergency regs being pulled back affect that in the future, Mike?
Well, we had that window open for a period of time. It's not currently open. Again, we had to close it down for a period of time, but that's something we can look at, and Chuck might be able to address that as for future regulatory modifications.
Sure. As Mr. Pointer stated, we opened an emergency reinstatement period at the beginning of COVID under those emergency orders, and we got over 1,000 EMTs and paramedics back into the system. Now, one may ask, well, how many of those went to work in an ambulance service? I have no idea, honestly. My guess is that some of them did, and a lot of them just wanted a free certification or license back. But we knew that in order for them to go to work for an ambulance service, to be reemployed, that we had to get their certification or their license back in their hand. We kept that free period open for about 3 months. No continuing education was required, and it was primarily due to the state of emergency, and we were fully expecting the hospitals and EMS to be offline due to backfills and all our own people getting COVID and not being able to work. So there's still a reinstatement process for retired or expired EMRs, EMTs, advanced EMTs, and paramedics. That's in place in our ordinary regulations. There is a fee and continuing education requirements that are attached to that currently.
I would just make the consideration, gentlemen, that if we continue to be in a shortage situation like we are, even if we're not during the COVID emergency, I think we should look towards extending that to the future due to the shortage and not just because of COVID-specific issues. Any other questions before we close out the meeting today? Seeing none, do I hear a motion to adjourn? Got a motion and a second. All in favor say aye. Meeting is adjourned.